Okay, if there's no other questions, we're going to move into the second topic, which is chelation. Chelation therapy. Many of you have a mineral deficiency, and many of you have heavy metals. Many of you have a circulatory problem, and a few of you have diabetes. Chelation has been very, very controversial. I was first exposed to chelation when I was a sophomore in medical school. I got a call from my uncle, who was a dairy farmer in Pennsylvania, and even though I was a sophomore in medical school, I was the doctor of the family. And he said to me, "Dr. Ed, what do you think about chelation?" I said, "Why do you want to know?" "Well, I'm having chest pain, and I went to the doctor, and they want to do a bypass on me, and I don't have any insurance, and they want like $200,000. And he was looking for an alternative. And he said, "A lot of my friends are getting chelation." And I said, "Well, it's not going to hurt probably to give it a try." So he underwent chelation therapy, and it completely eliminated his chest pain. He was back working on the farm. And a few years later, he started getting the chest pain again. But now he had insurance. So he thought, let me get the triple bypass surgery and get it taken care of. But he didn't follow up with the chelation. Normally with chelation, you get an aggressive treatment and then maintenance once a month. So he had the open heart surgery, had the triple bypass. After the surgery, he still had the darn chest pain. And the doctor said, "Well, it's all in your head. All the vessels are clear." So he went back to get the chelation therapy, and the chest pain went away. So after that, I said, this is kind of interesting. And then I found out a colleague of mine at the Shea Eye Institute, and this guy was brilliant, Dr. Harold Beyer. He had a PhD in optics while he was going through his ophthalmology training. So this guy, really had the brains. And I found out that he's doing chelation therapy for macular degeneration. And I said, "Harold, what in the world are you doing chelation for macular?" He said, "Well, it works." So I became interested in that, and then I found out about Bill Coors, the ex-president of Coors Brewing Company, who was a big advocate of chelation. And I talked with him about his experiences with chelation, and he was kind enough to read the manuscript of my first book, Alternative Therapies to Improve Your Eye. It was my first book. And he liked it so much, he decided to write the foreword to the book. So even now, if you research Coors, macular degeneration, my book comes up. He shows up as a co-author of my book. And his family was really upset because they thought that I was using the Coors name to market my book. But he was really adamant. He loved the book, and he really wanted to get the word out about chelation therapy. There was a study done recently called the TACT study, T-A-C-T, Trial to Assess Chelation Therapy. And this study was set up to actually disprove chelation therapy. It's a 10-year study, $30 million, sponsored by the NIH. And I think it was really a good study, because what they did is they got sick cardiac patients. You had to either have active chest pain, one or more cardiac medications, a stent, previous bypass surgery. These are sick people. And what they did, they divided them into two groups. One group got chelation. The other group got sugar water. The doctor didn't know what the patients were getting. The patients didn't know, and a statistician. So this was a perfect control study. It eliminates bias from the doctor, the patient, and the statistician. When they broke the code, it was shocking. There was as high as a 38% reduction in the major cardiac event, those that got chelation. And the subset that got the best result was the diabetic. Now, of course, they didn't look at eye disease, but just about every one of my patients who do undergo chelation have an improvement of their vision. My father, when he was alive, had really bad heart disease and had heavy metal poisoning, and he underwent my insistence, underwent lots of chelation therapy, and every time he did a chelation, he felt his vision was better. He didn't really have any vision problem. He didn't have macular, but he felt it improved his vision. So I recommend chelation therapy, well, for 3 reasons. If you have heavy metals, something definitely you need to put up there high on the level of alternative therapies. If you have a known history of cardiovascular disease, circulatory problems, or diabetes, a must. If you're a diabetic and you have eye problems, I would run, not walk to the nearest doctor who does chelation. Probably one of the best treatments you can do. You're all being tested for heavy metals. Many of you are deficient in essential minerals. And a lot of alternative doctors feel, and so do I, that one of the best ways to get those essential minerals back to a normal level is to get rid of the heavy metals. The heavy metals are big bullies. They're huge molecules. You know, like the lead molecule is about the size of this room. And the zinc, selenium, chromium are little guys. So when you have these big bullies, they push the good guys away. So you can be taking extra zinc, extra selenium, and you just may not get the functional levels until you get rid of those big bullies. Now, the only problem with chelation is if you're getting the IV therapy, there's 3 ways of getting chelation: IV, rectally, and orally. Unfortunately, the IV therapy is the most expensive, time-consuming, because you've got to go to the doctor, travel time, being there for an hour or 2 getting the IV. But it's the most effective. So if you really have poor circulation, your diabetes is out of control, you have heavy metals, you need the IV. You need the IV. I would make every effort to get the IV. But if you just have moderate circulatory problems, your heavy metals aren't too high, then I'd look at the option of the rectal suppository called Detoxifying and the oral called ocular detox. And that's kind of what I do. My lead is high, my mercury is high. I do a lot of traveling. I really don't have time for the IV. So I do the rectal detoxifying 3 times a week, Monday, Wednesday, and Friday. And I take the oral every day. I do that every day. And I try to get an IV maybe once a month. And that's what I recommend for you folks. Find somebody who does the IV, maybe get the IV once a month. And do the rectal 3 times a week and the oral every day. So getting back to the attack study, when this was published, it was the lead article in the Journal of the American Medical Association, the most widely read journal. Front article. And you pick it up, it's there. So my son's father-in-law is a top cardiologist in Port Charlotte. I love him dearly. His nickname is Putin. He's Russian, and he looks and talks just like Putin. When we first met him, my wife and I immediately said, "Oh, that's Putin." So we would refer to him as Putin behind his back. So when we had a family get-together for Thanksgiving, we met with some of his friends, and as soon as his friends walked in, he said, "Hey, Putin, how are you doing?" Everybody calls him Putin. But he has the short hair, the Russian, the same thing. But brilliant cardiologist. We're having Thanksgiving dinner, and I said to Putin, "What do you think of the tax study?" He never heard of it. I mean, a cardiologist never heard of it. And I said, the study about chelation. He said, "Oh, they disproved that years ago." So we were talking about how slow progress is made in medicine. Yeah. Never heard of it. And I'm sure if you go to your doctor and talk about chelation, it doesn't work, or they'll say, "I read the study and it wasn't done well."
I don't want to know about it.
Oh, I think in Australia, aren't you required to have chelation before open heart surgery? At one time, I read that.
No, not really.
Mm-hmm. So chelation is a very important part, so I'll talk to you individually about the best protocol for you. But even if you're healthy, we are being exposed by toxic metals. And patients always say to me, Dr. Kondrot, my lead is so high. Where did I get it? Well, we grew up in a time we had leaded gasoline, leaded paint, leaded pencil. I can remember in grade school playing with mercury. They put the mercury on my hand, on the floor.
Yeah.
Right? You too?
Sure.
It's absorbed into your skin. And most of us have mercury amalgams. And those damn fluorescent lights have mercury in them.
Yeah.
So, it's a full-time job detoxifying our body. So, not only making sure you're putting good nutrients into your body, when you're eating healthy, raw, organic fruits and vegetables, you're putting sunlight into your body, alkalizing your body, putting energy into your body. If it's cooked, steamed, you're losing the nutritional value. Plenty of water, good hydration, and detoxifying your body. These are the keys. Detoxifying your body. So we're going to watch the video, Get the Lead Out, which talks about the tax study. Also, I wrote a book called Chelation Therapy. I interviewed, I think, 15 doctors who are advocates of chelation, including Dr. Terry Chappell, who was involved in the tax study, very knowledgeable, involved in the tax study. So any questions on chelation?
Is it possible that we need to kind of make a study of who's doing it in case, sometimes there's a product that is not good? Is there a chance, or is it something that is so easy in a way to put together that it will be the right thing?
Well, there's an organization called the American College of Advancement of Medicine, ACAM, ACAM, Apple Charlie, Apple Mary, and they have a website, acam.org. You can find doctors who are trained in chelation. There are many different ways of doing IV chelation, many different ways. I like to use the TAC protocol. This is the protocol they used in the national study, but it's a 2-hour IV, so a lot of people don't like that. Some doctors do a mini chelation. There's all sorts of variation. So go to a doctor that's trained, that's certified, and they're going to customize it for you because it also depends on your kidney function. First thing they do is they do a creatinine clearance, see how strong your kidney is. They may want to make some adjustment in the amount of IV that you get. So you need a competent doctor, but if any doctor you go to has questions or they want to talk to me, I'm not an expert with chelation, but I do recommend it for eye conditions. And many of you want to know, well, if you like chelation so much, Dr. Kondrot, why don't you do it here during the program? Well, the reason why we don't do it here, I only want to do therapies that are really going to shift your vision. I only have 3 to 4 days to prove to you that these therapies work. Unfortunately, chelation takes 20, 30, 40 treatments before you see a result. So I don't want to waste an IV. I shouldn't say waste an IV or take up that IV time doing the chelation when you should be getting something else. Also, interestingly, doctors are combining chelation and ozone. It's called Kezo. Dr. Frank Schellenberger is a big advocate of this. You get a chelation and an ozone treatment at the same time, which makes sense to me. You're there at the doctor, you got an IV started, why not get both done? So that's something to consider.
In one IV?
One IV.
Wow, nice.
But I did research and there was none around Connecticut. There were, over here, you were the only one on the ozone that was doing dealing
For
with
the eye. Well, that's why I want to empower you with the rectal insufflation. Because I like it when patients, now some of you are having problems with the rectal. There are alternatives. You can do auricular ozone. Auricular ozone is you put a stethoscope and it goes into your ears. I don't like that as much simply because there's more gas going into the air. You need a fan. you need proper ventilation. So it's not as safe as the rectal. You can also do vaginal. I have some patients that are doing vaginal. The men aren't doing vaginal. So that is an option. Okay, so now we're going to have fun. We're going to finish up with the ultraviolet blood irradiation.